Hi everyone, my name is Emil Suriel Peguero and I am a second-year medical student at OU-HCOM, and today I would like to talk about low back pain and muscle energy and how it fits into osteopathy. Here's a little more about myself. On the left, it's me when I was an undergraduate student doing my bachelor's in athletic training at Ohio University. In the middle was during my gap year before medical school when I was working as an athletic trainer. And then on the right, as you can see, it's the best day of my life. Now let's do a little overview about low back pain. Low back pain is the leading cause of activity limitation and work absence worldwide. Most people will experience low back pain at some point of their lives for one reason or another. Those reasons range from psychological changes in the brain to visceral changes in the internal organs that may manifest as low back pain. The most common cause is musculoskeletal changes and dysfunctions found in the back musculature and adjacent areas. And as an athletic trainer, I see a lot of patients with low back pain due to acute or chronic sports injuries, and being familiar with the osteopathic approach to diagnosing and treatment has really helped me provide much better care for my patients. The treatment of low back pain truly depends on the source of the pain. As a physician, the main focus is to find the root of the problem and then consider possible treatments. For patients with musculoskeletal low back pain, there are a multitude of options including rest, heat packs, massage, targeting specific muscle groups with exercises, and OMM manipulations, among many other non-pharmacological options. If these treatments do not help the patient, then medications are considered in addition to those other options. One of the many OMM treatments available for low back pain is muscle energy. Muscle energy is a technique that uses the patient's own force to induce relaxation of a muscle group, or even use the muscles to cause movement at particular joints. Personally, I am a fan of muscle energy because of how easy it is to use and how quick a treatment can be performed. This can be done virtually anywhere, as I will be demonstrating in a few seconds. The physiology of muscle energy is complex depending on the treatment goal, but to summarize it, contraction of a muscle causes relaxation, and we take advantage of that reflex to treat our patients. For low back pain, there are different setups to perform muscle energy. I will be demonstrating a sideline position because it looks really cool, and also because the same setup can be used for follow-up OMM techniques such as HVLA that works on back joints. So the patient is going to start supine facing up, then I'm going to ask them to turn to the side facing me as much as they can. There we go. Next I'm going to grab his upper leg and put it underneath the lower one. That way there isn't too much motion at the hips. Next I'm going to ask him to grab my arm with his lower hand and twist them as far as I can. I'm going to ask him to interlock. Put one hand underneath, and this hand goes in the back where we diagnose the dysfunction. Next, we're going to twist the patient as far as they can to that area. And next, I'm going to ask them to push against me for 3 to 5 seconds. And relax. And then each time, I'm going to push a little further. Go again. And relax. And then one more time. Ready, go. And relax. Just like that.